UltraFlo-S Slide-Shield safety blood collection sets and evacuated blood collection tube or syringe are used together for the collection of venous blood. They feature flexible textured wings for easy handling, soft kink-resistant tubing, and are available with or without a tube holder. The winged needle is designed with a safety shield, which can be activated to cover the needle immediately following blood collection to aid in the protection against accidental needle stick injury. Select needle gauge depending on the patient condition, such as age, weight, pre-existing conditions, physical characteristics of the vein, such as size, location. For blood collection, the volume of blood needed to be collected. For infusion, the prescribed therapy and patient need. The following are recommended needle gauges for venipuncture or infusion procedures for different age groups. Green 21 gauge is recommended for adults. Blue 23 gauge and orange 25 gauge are recommended for adults, pediatrics, elderly, or patients with small fragile veins and neonates. Be sure to always wear proper personal protective equipment according to your facility's guidelines. Open the peel-apart blister packaging and remove the device. Remove the protective plastic sheath covering the multi-sample needle and thread the tube holder clockwise onto the multi-sample lure adapter that is pre-attached to the female lure connector. Wrap a tourniquet around the arm above the insertion site. Palpate the site to locate the vein. Disinfect the insertion site utilizing a circular motion. Remove the needle's protective sheath prior to needle insertion. Anchor the vein with your non-dominant hand and insert the needle at a shallow angle, holding onto the wings of the needle hub. Watch for a flashback of blood to confirm that the needle is in the vein and ready to draw blood. Place the first blood specimen tube into the tube holder. Remove the tourniquet once good blood flow is established. Place an absorbent pad over the insertion site. Remove the needle from the vein. Slide the translucent safety shield forward with the other hand, pulling the tubing backward until an audible click is heard, indicating the needle is completely retracted and locked in the safety shield. Apply pressure on the insertion site to stop the bleeding. Dispose of the device according to your facility's guidelines into a designated biohazard sharps container.